Can an ACL tear heal on its own? If you have been told that you have anterior cruciate ligament injury in your knee and you are wondering whether it can heal naturally or without surgery, so we are going to talk about that in today's video. This is one of the most common questions that comes to your mind whenever somebody is diagnosed with ACL injury in your family. ACL stands for Anterior Cruciate Ligament. It is one of the major ligaments inside the knee, the chief stabilizer of the knee joint. Its main job is to keep the knee stable and prevent the shin bone from moving excessively forward. It is especially important during activities like running, jumping, pivoting, or sudden change in the direction. Now, how does an ACL tear usually happen? Normally, it happens in sports like football, cricket, badminton, or basketball, when there is a sudden twisting of the knee that leads to an awkwardness within the knee and there is excessive pressure on the anterior cruciate ligament. It can also happen during road traffic accidents or fall from height. Now, the most important question is, can a complete ACL tear heal on its own? A short answer is no, it cannot, because ACL has very limited blood supply. Unlike other tissues in the body like bone, skin or muscles, which are richly supplied by blood vessel, ACL has a very poor blood supply and it cannot heal back to get its original length and strength. Therefore, a complete ACL tear usually remains torn. But after some time of this injury, you will start feeling better. Like the pain will go away, the swelling will reduce with time. You can even work on your muscles to make them stronger and you can regain the confidence and start walking normally. But feeling better does not necessarily mean that the ACL has healed. If you will do an MRI after 3 to 6 months, you will still find there is a broken ACL ligament. So can you live without an ACL ligament? The answer is yes, if you adapt to a sedentary lifestyle, or if you are a low demand individual like more than 70 years old, or if you are not very much into sports, or if you can avoid stairs, then of course you can live with a broken ligament, that is ACL. But if you are having complaints of repeated swelling in the knee or pain or instability, or if you are not able to participate in sports or climbing stairs, then that means that your body is asking for a ACL reconstruction surgery. Now, what happens if you ignore this for too long? These repeated instabilities may lead to meniscus tear. Meniscus tear is a cushion-like thing between the bones. So if ACL tear is ignored for long and you are still engaged in activities like running, sports or climbing stairs repeatedly, it can lead to the tear of this cushion, which is known as meniscus. Next step is, it can lead to cartilage damage in the knee joint, which can lead to frank arthritis, deformity of the knee, and ultimately the need for knee replacement surgery. So sometimes the bigger problem is not ACL tear itself, but the repeated instability that follows, that leads to meniscus injury, that leads to arthritis. Now, does every ACL tear need surgery? The answer is still no, because it depends on your age, your activity level, the degree of instability, whether it is a single ACL injury or there is PCL injury or any other ligament injury of the knee, or if you are active in sports, or what kind of occupation or lifestyle you are in. So all these 6 factors together constitute the need for ACL reconstruction surgery. Your age, activity level, degree of instability, is it a multi-ligament injury, are you engaged in sports, or what is your occupation? So based on these factors, your doctor will tell you whether you need the surgery or not. If you are able to restrict yourself to a low demand life, if you have a stable knee, or if you are somebody who can modify his lifestyle, then of course you can pull without ACL reconstruction surgery for some time with physiotherapy, quadriceps and hamstring strengthening exercises, or activity modification. But if you are someone who is young and active, an athlete or a sports person, or if you have recurrent instability in your knee, or if you have developed meniscus injury along with ACL injury, or if there is any other ligament injury in the knee along with ACL, then definitely you should adopt for ACL reconstruction surgery, which is done through arthroscopy. So a completely torn ACL usually does not heal back on its own. Some people can function well without the surgery if they cut down on their activities of life. But if you are young and active, then ACL reconstruction surgery should be done. Otherwise, repeated instability can lead to meniscus injury and accelerated rate of arthritis in the knee, and ultimately you might end with need for knee replacement surgery after few years or few decades. So all the best.